Good morning.
Can I have your IC, ma'am, just to verify?
Yes, it is right here.
Okay.
Somewhere in the central part of Singapore is a drive-through like no other. This is where I can go for a COVID-19 swab test. I won't have to leave my vehicle, which means reduced contact with others.
But I'm not actually going to swab because this station is for people who are showing symptoms.
Or if you are part of a targeted group considered high risk. This could be a frontline healthcare worker, a construction worker, or a nursing home resident. Community cases in Singapore have remained low, in the single digits over the last 2 months. But I can't help but wonder, why can't I get a test, even if it's for a peace of mind? After all, I'm willing to pay for it. So in this episode, I want to find out if we should allow COVID-19 tests for everyone, and if not, why? Currently, there are only 2 places where testing is done on a mass scale, meaning everyone can get tested: Wuhan and Hong Kong. In Wuhan, nearly 11 million citizens went through mandatory testing. And over in Hong Kong, mass community testing kicked off on September the 1st. It's voluntary, and any of its 7.5 million residents can go get tested for free. I want to know what it's like to be able to get a COVID-19 test anytime and for free. And find out why are cities like Hong Kong embarking on it. So let's go there. Okay, I never actually went to Hong Kong. Wei Du, our CNA correspondent, is helping me out there.
Wei Du, thank you very much for your time.
She tells me that Hong Kong announced its plan to mass test everyone during its 3rd wave of COVID-19 cases.
It really caught everyone by surprise. Locally, medical experts have said it could just be silent local transmission that never really went away. So they're saying that could be the source.
On average, how many people did they manage to test per day?
Actually, they planned for a capacity of up to 300,000 people per day.
Even as we speak, Hong Kong is coming to the end of the first week of mass testing for everyone. How have the results been so far?
In 3 days, they managed to test 470,000 people, and only the first batch of these results. And so far, they've managed to find 6 positive cases.
The low rate of positive results has sparked off quite a bit of debate in Hong Kong about the cost-effectiveness of the mass testing program. After all, the Hong Kong government started the free program to track down asymptomatic COVID-19 carriers. So, is mass testing really worth all the effort? I'm hoping to get some answers from a man who has spent the past 20 years researching infectious diseases. Wuhan has mass tested its population, and Hong Kong has offered to do so for its citizens. Now that the infection rate is quite low in Singapore, why don't we make use of this opportunity to mass test everyone?
Whether to go down the routes of a mass test or not, I think would depend on where we think we are in terms of the pandemic. If the situation is under control, kind of like what's happening in Singapore now, then the mass testing actually would not be very cost effective. If the situation appears to be spiraling out of control, like what happened in Hong Kong and in Wuhan with the second waves, then for them the calculation was that the mass testing makes sense because they want to catch more cases and try to stop the second wave or the third wave from getting really out of control.
A key part of mass testing is the testing capacity. Are we there yet for Singapore?
We are not quite like Wuhan or Hong Kong that can test hundreds of thousands every single day. Therefore, I think if we wanted to test the entire population, at this point we don't have that capacity for it. It's not just about having the testing capacity in the laboratory, but it is also about setting up testing centers, getting people who are able to do swabs properly, registering these people, sending out the mass communication that people should come for testing. All that is a massive exercise that is not easy to do in many countries around the world. Cost is an issue for every country, no matter how rich they are.
Isn't it worth it to catch the asymptomatic persons?
When we do a PCR test, for example, we would pick up those persons who were asymptomatic, but at the same time, we will also miss those who are incubating the virus. So a person in the incubation period where the virus is still replicating in the cells but has not reached a high enough number such that it is shared by that person, that few days, that person will still test negative for the virus. So a once-off mass test will pick up some cases, but it will still miss others.
So in Singapore, we are choosing to test only those in the high-risk category. I'm standing right in front of the float at Marina Bay. This is one of the regional screening centres set up to support COVID-19 testing. However, it is not for walk-in requests, but rather as testing expands in the community, you will see groups such as taxi drivers, construction workers, food delivery personnel, as well as hawkers coming in to get tested.
Meanwhile, I want to find out why Hong Kong is investing all its resources if mass testing has so many limitations.
If I remember correctly, a couple of months ago, that was still seen as a wacky idea, even when they did it in China. Does it actually make sense?
Hong Kong has launched a mass testing exercise. Anyone can get tested for COVID-19 for free. It involves thousands of swabbers and lab technicians. Why did they see the need for this investment? My colleague in Hong Kong, Wei Du, is going to find out by speaking to Professor Gabriel Leong. He's famous for forewarning Hong Kong residents that the virus is mutating and becoming more infectious.
This coronavirus actually spreads during the incubation period, that is when nobody has any symptoms, to the extent that it's probably around 40%. But if 40% of all of your cases are actually transmitted when nobody's showing any symptoms, that is what makes this so difficult to control. And that is why waiting for symptoms is probably too late.
If I remember correctly, a couple of months ago, that was still seen as a wacky idea, even when they did it in China. Does it actually make sense?
I think the logic is quite simple. I think testing capacity has to be looked at in terms of what kind of interventions we have in our tool belt. And there are really only three. One is border measures. Two is physical distancing measures. And the third group of measures are what I call TTQI, test, trace, quarantine, and isolate. If you look at the Hong Kong situation, much like a lot of other places, we've basically maxed out on the border measures already. The physical distancing, Hong Kong, like Singapore, is a very densely packed city. That's why you can't really push anymore if you still want to keep some semblance of a normal functioning society. So you only have TTQI left. So if you then look at that and you say, hey, what can I do better? The best thing is if you can make sure that there is no more hidden pockets of infected seeds out there. And that's why your testing volume has to be so large in order to pick up those remaining pockets of silent transmission chains that might still be out there.
Authorities here see long-term advantages in mass community testing. If everyone is tested, we can get the economy up and running much faster. But more importantly, this would also open up travel options. Right now, to travel from Hong Kong to mainland China, everyone needs to have a negative result produced within 24 hours. So this would make it a lot easier for Hong Kong residents who want to go to mainland China for work or visiting family.
To facilitate mass testing, 140 collection centres were set up across Hong Kong.
I've not been given permission to go inside any of the sample collection centers, so all I can do is to show you what's going on from the outside. They've been set up in sports stadiums and government schools. Right now, I'm outside at Queen Elizabeth Stadium where testing started at 8 o'clock in the morning. I'm told that this is a massive undertaking.
Once the sample is taken at a testing center, it is sent to a lab. The specimen is put through a process that lasts about 6 hours to detect whether it is positive or negative for COVID-19. So far, the government is only able to announce the test results of the mass exercise every few days.
We've had the Secretary for Food and Health, Sophia Chan, telling a press briefing that wearing a mask indoors will be made mandatory.
Professor Sophia Chan has been at the forefront of the COVID-19 battle as Hong Kong's health secretary. Wei Du meets her to find out how Hong Kong is coping with all the samples.
Talk to me about the scale of this testing program.
With the public testing capacity, we have not been able to do it very fast, but with the increase in capacity by our private laboratories, a number of them are from mainland China, because of the national help by the central government, we have been able to go not only for the target group testing, but also the universal community testing.
Somebody could test negative today and get infected tomorrow. Does this mean this population-wide testing would have to be repeated periodically into perpetuality?
Well, I think the mass testing will be a one-time thing. But then the target group testing, some of them will be periodical. For example, some of the high-risk groups that we think is very important. For example, people who are working in elderly homes. We also repeated testing the people who are working in slaughterhouses. Those are critical facilities. Therefore, people who are working there, it's important that they are free from COVID-19.
I'm headed towards the Sun Yat-sen Memorial Park Sports Center. That's where the mainland Chinese testing companies have set up their makeshift labs. These are 16 gigantic air-filled chambers, and the government says that together they can process up to 300,000 samples per day. Hello.
Hello.
Can I go inside?
Hi.
Hi.
You are media?
Yes, I'm a member of the media. Am I allowed to go inside?
Without permission, no media can go in.
Okay.
Yeah. This company and this company, they have this 3 label. Without this card, no one can go inside.
Okay, all right, thank you. Yeah. I'm not allowed to go inside. Only the people who work for the 3 Chinese testing companies are allowed to do that. But inside, there are more than 400 lab technicians from mainland China working around the clock. Interestingly, the labs are called the Fire Eye Labs. Now, fire eyes in Chinese folklore can see through all sorts of disguises. Now, you wonder what's the cost of this? Well, the testing side is actually paid for by the mainland Chinese government, and the Hong Kong government only needs to pay for sample collection, transport, and public promotion.
Singapore is not mass testing on a large scale like Hong Kong, but there are plans to ramp up testing capacity from 13,000 to 40,000 tests a day by year-end. I'm meeting with this man.
Yo, Dr. Yo here. Yo, Dr. Yo here. Yo, Dr. Yo here.
Who tells me that Singapore is gearing up for the increased testing capacity. One way it's doing so is by having more drive-through tests.
We can test around 2,000 people every day in this facility alone. And in terms of ramping up, this concept of having the drive-through and testing can be replicated anywhere in Singapore as long as you have space for setting up of the station, you have space for the people, the swabbers, and also the cars. So ideally, some public car parks, like the really big one at National Stadium, that will be a very good location to set up a drive-through. And you can also consider other locations like schools or community clubs or even army camps for this purpose.
The swabbing is just one part of it. You can swab a lot of people, but what about the back end? How fast can your laboratories cope?
Our lab can do presently about 5,000 tests every day, and the turnaround time is within 24 hours upon receiving of the swab.
Do you think Singapore is prepared?
In terms of manpower and expertise, we have already started to ramp up. The second thing that we consider would be the supplies of personal protection equipment, masks, universal transport medium, as well as swab sticks. Initially, there was a global shortage, right, and we had difficulty trying to get our sources directly. But the Ministry of Health also stepped in to support us. They allow us to draw down from the national stockpile, and that really helped us to improve our logistics and supplies.
Currently, this is how we test for the virus. Swabbers have to insert a long stick up your nose. The swab has to go pretty far back to the back of your throat in order to collect the cells and fluids. It's invasive and not very convenient.
This is a self-collection kit.
How is this done?
There are easier tests in Hong Kong. It's simple, non-invasive, essentially something you can do on your own. Can these be employed on a larger scale?
I'm in a laboratory at the National Centre for Infectious Diseases. Here, samples are tested for COVID-19 using the PCR method. This means that a throat or nasal swab is taken by healthcare professionals. Now, clearly, this method requires trained manpower, and a lot of them. I also find that the swabbing is a little bit uncomfortable. So, is there an easier way?
In Hong Kong, one was introduced in April. While health authorities in Singapore have not approved any COVID-19 test kits for home use, private companies in Hong Kong can sell test kits online. Genetic testing company Prenetics has been selling their test kits online for 5 months.
And then they put the samples into a machine?
They're going to transfer to each of the different rooms.
While it cost 140 Singapore dollars, it's been madly successful, with 100 kits selling out every day.
How is this done?
So it's a deep throat saliva test. Ideally, you do this in the early morning. Once you wake up, then you have to make the "krr" noise, right? And then so it's deep throat saliva where your viral load is the highest in the mornings.
In a lot of countries, the way they do it is a nurse will come to you and stick a Q-tip into your nose. What's the benefit of doing this?
You can do this in the comfort of your own home, and it's also much safer because there doesn't have any risk from the healthcare worker of potentially getting infected ones, right? At the same time, it's also a much comfortable process for the patient because you don't have anything sticking in your nose or your throat-wise, right? Currently, we're processing 20,000 plus on a daily basis.
All these samples, do you send people out to collect them?
We have 20 to 30 vans going out, delivering the kits and as well as collecting kits the next day. We've also set up mobile collection vans in different districts to make it easy for people to drop off their samples at the same time. We provide videos, tutorials so they can actually understand how they do the sample collection properly.
You do 20,000 samples a day. Right now, on an average day, how many of them will turn out to be positive?
So it's anywhere between 3 to 4 when we look at 10,000 people.
What's the accuracy rate of this?
So basically, the accuracy is 99.9%.
The DIY test kits can be used by Hong Kong residents who want to cross into the mainland. They will get their results in 24 hours. Now, here in Singapore, any pre-departure testing has to be done at one of these designated clinics. We will get the results in 2 to 3 days.
Ho Ming Kit, head of the Singapore Business Federation, would love to have easier and quicker test kits available in Singapore.
For Singapore, we are the regional hub. Many MNCs are located here. They do need to travel. Like for example, right now, you have to do the test either 48 or 72 hours before, wait for the results. go to their destination country, and I think currently the results is at least a day before it's done. If you add it together, it's 2 to 3 days before you can then start on your itinerary.
Let's talk about testing. What is on your wish list for business travelers?
Say if we take that scenario of, say, us being able to bring in many business travelers from China over, they'll come in a plane load, 200, 300. You come in, everybody is tested within 2 hours, a plane load of maybe a couple of hundred, and then after that you get your results within 2 hours. So can that be done?
Right. So you're really talking about not just the speed of tests, but also the speed to get the results.
That's right. Say a saliva test, results known within 1 hour, right? Everybody tested within another hour. The whole plane load is cleared within an hour. I get out of the airport, I'm out. I don't have a control itinerary. This is what we want.
Simple and quick. That's the kind of COVID-19 test business travelers want. But how accurate are these non-invasive tests? I've arranged to visit the National Public Health Laboratory. It's one of the places where samples are tested for COVID-19. And I'm meeting the man who started this laboratory back in 2007 to investigate disease outbreaks in the country.
If we want to mass test everyone, which of the non-invasive tests can work?
So for something which is convenient and relatively comfortable, obviously saliva will be the least uncomfortable. So this is the controversy. There have been study groups which have found quite good sensitivity. That means they can pick up 90% or even more of the positive cases. But earlier in the year, when NCID did a trial, we picked up only 40 to 50%. That means you miss half the cases. So the results are very varied.
So suffice to say that for the saliva tests, probably too many uncertainties at the moment.
Exactly, yes. In terms of testing, the most accurate test is still the PCR test. There are certain PCR tests which can be done faster. For example, in this cartridge, I can actually take a sample, put it in a cartridge, and the result can be out in slightly over an hour. Unfortunately, this kind of test, you can only do like 4 at a time.
Meanwhile, mass community testing wrapped up in Hong Kong after 2 weeks of testing. The results? 1.8 million tests were done, which is well below the 7.5 million target they set out.
So in Hong Kong, not everyone took up the free mass testing offered by the government. But still, over 1 million is not a small number. It shows that people are open to the idea of being tested despite its limitations. What I've learned is that while Singapore won't be expanding mass testing to everyone, there are groups that need a quicker, more efficient way of getting tested. So a quick and accurate test that is readily available will be a game changer, because in the absence of a vaccine, testing is really the only way to control outbreaks.